welcome to today's ASMR video. I am very pleased to be working with HelloFresh again, who have kindly sponsored today's video. I have tried some tasty new recipes this week as I'm trying to eat less meat, and I always just feel like vegetarian meals are a bit less exciting. HelloFresh has loads of tasty veggie meals you can choose from. Things I'd never usually make, but they are so easy and taste really good. I've chosen the goat's cheese naan flatbread with beetroot and walnut salad because I'm quite into cheese at the moment. Valentine's Day is just around the corner, and HelloFresh have lots of different meals, 2-course meals that you can choose from, whether you're going to be staying in and cooking for one or you want something a little bit more special. And well, if you're on your own this year, that's an even better reason to make something nice to eat and put on a cozy film to watch. I've personally given up on restaurants because I'm always so disappointed and feel I could have cooked it at home. Why not make your evening special and choose a 2-course menu for yourself or someone special to impress? HelloFresh is also really great for getting organised with your meals, keeping on top of your food spending and cutting down on your food waste as it has pre-measured food ingredients. HelloFresh are currently running a limited time offer. What's special about this offer is it's for new and previous customers who cancelled their subscription a minimum of 3 months ago, where you can get 60% off your first box and 25% off your next 2 months. Have a look at the recipes and try your first box, and you can make something delicious like this. Right, let's have a look then. So I'm just going to have a look at the symmetry of the face to begin with. Just making some notes on my ruler here. You just tell me what kind of look you're wanting. Okay. This area here. And what about up there? Okay. Let's see what can be done first. Okay, just keep nice and still for me while I take some measurements. Looking at the cheekbones there. Okay. Eyes. Yep. Okay, so the eyebrows, just make a couple of dots on the face there, just trying to map out okay. Let's have a look. So there are some measurements that your face should follow. So let's see. And then I'm going to have a physical examination of the face just to make sure that we can go ahead with some work. Okay. Yeah, we are a private clinic here, so obviously the NHS won't fund any work because they've said that you don't need it, but obviously we're here to help where we can, and we can do work obviously at a cost. So that's two. Just trying to check the symmetry of the face here. Okay. Nose. Okay, I'm just going to have a feel. Is that painful at all? Okay, let me just take the rest of these bandages off you. Okay, I'll dress it again at the end. It's good to get some air to it in the meantime. Sorry. Okay. Okay, it's got a fair bit of swelling there. Feeling on the lips. Okay. Just going to feel the texture of the skin, so just some light tapping, okay? So I'm just going to do some pinching just to feel the elasticity of the face. Okay, please let me know if it's any pain at all or if it's uncomfortable. Okay. Okay, so the skin feels very tender, very kind of filled with fluid, so it's quite hard to see, but there doesn't seem to be any cartilage damage underneath the skin, which is great. So, do you want to just tell me what you were kind of hoping for? Okay. Okay, so just a slight lift, yeah, okay. In terms of putting any kind of, just to kind of fill the face where there may be some misalignment in the symmetry, I did note that this side there was some fat missing just on the cheek area. Yeah, you've noticed, okay. We can look to fill that in if that's something, okay. Okay, and the eyes, a tiny lift, yeah, okay. Okay, the chin area, yeah, I can see that was a fair bit of trauma there. Okay, we can look to build that back up. Yeah, okay. Okay, what I would recommend actually, just on this area here of the forehead, I think I'd like to do a bit of a skin graft there, okay? Just because I think that is going to scar. Yeah. Okay. And in terms of some tweaks just to help improve the overall symmetry of the face, I'd recommend just allowing us to do some lifting very slightly. Okay, so in terms of the symmetry of your face, it is slightly off just in the middle there. So I would look to just pull this area up here and this side bit, just pull that back a tiny bit. Okay. And then just due to your age, I wouldn't recommend doing anything else, okay? Because I really just want to avoid doing anything unnecessary. Okay, I think it will heal really well. Yeah, okay. So the hairline, I can see in my notes, you mentioned something about your hairline. You want to bring that forward a little bit. Okay, so that does sit with another team. We can do a hairline examination and talk about some hair filling. You want to reduce the forehead size. Okay. Okay. And then just finally, we do offer a skin consultation as well. So I'm just looking at the texture of your skin, and I would say it would benefit from one of our treatments. So we can do a chemical peel, which will just remove the first layer of skin and help with some of the scarring. Yeah, okay. So I will get my secretary to kind of work this all out, but we are looking around the 12,000 mark. Okay. We do have a variety of finance options available. Yeah, we do, so don't worry about that. So what I'd actually like to do is just take a closer look at the skin first. So just scraping the skin just to skin is in fairly good condition. Okay, you're keeping it nice and moisturised at the moment. Okay, good, yeah. I'm just going to have a look at the texture. On the sides here. Okay. Just very gently over the top. Okay, yeah, skin's looking really healthy. How are you feeling in general? Okay, so I just want to check your temperature and your heart, and just check a few things just to make sure that you are fit and well. We can go ahead. Okay, so I'm just going to listen to your heart first of all. Just find the right area there. Okay, let's try and keep nice and still. Okay, good heartbeat. Nice deep breath in and out. And in and out. This around the back, that's okay. Nice deep breath in and out. And then again in and out. Have they put you on any medication? Any painkillers? Okay. And what dose is that? Okay. So I'm just going to take your temperature. Okay, let's do that again. Okay. Now I just want to check to see whether there's been any nerve damage on the face, okay? So can you just copy my facial expressions? So first of all, nice and tight eyes. Okay, and now frowning. Okay, turning the head to the left. And this way. Okay. Any pain when I'm touching along here? Okay. Along the nose, any pain at all? Just some soreness, okay. And you can feel all of this as I'm touching. Okay. Any numbness or tingling down one side of the body? So, any pain or tingling or numbness triggered when I do this? Okay. A little bit of tingling at night. Okay. Just along here. Okay. So there may be a little bit of nerve damage. Can often be temporary, so it's not anything to worry about at this stage. Okay. You feel all of that? Yeah. Down the front of your neck. Yeah. And on this side. Okay. Just have a feel around the ears. Any pain when I press here? Okay. Okay. Now if you could just look at my nose. Pupils are reacting nicely. Just to get you to follow the light here. Some circular motions, that triggering any shaking from left to right, any blurred vision, double vision. Okay, just putting a little bit of pressure on the eye. How did that feel? No sharp pains in the back of the head. Okay. Okay, just looking at the light here. And now my nose. at the light, and then at my fingers, and my fingers, and then at the light. Okay. I'm feeling around the back of the head. Okay. There's no trauma to the head. Head feels okay. Okay. So, we've talked about just lifting up these sides here. I think that will make a big difference. Just, yep. We're just lifting there. Just having a play and seeing what might look best. Just going to make some marks on the face.